All right, I'm Dr. Scott Gradwell, and I am a periodontist. A periodontist is a gum specialist as well as a treatment plan specialist. We do not work independently. We need the resources of a restorative and aesthetic dentist such as Dr. J. Friedman. We've had the opportunity to work together for the last 26 years of our lives, professional lives, and it has been a rewarding experience. So I'd like to talk a little bit more about what a periodontist does. We treat a gum disease, gum infection, from gingivitis to advanced levels of bone loss, which cause tooth loss. There's approximately 50 million Americans that have periodontal disease, and this disease is the #1 reason that people lose teeth over the age of 40 years. So the office here at Dr. Friedman's has a soft tissue management program that has been in place for 26 years, and it has allowed people to maintain their teeth far into their 80s and 90 years of age because of this program. Now let's talk a little bit about what that program looks like. We can do conservative measures such as scaling and root planing, non-invasive therapy. We can use chemotherapeutic agents such as Arrestin and or a drug called Periostat. Both are very effective against the treatment of beginning periodontitis. When things have progressed to the level that need more intervention, then we can consider periodontal surgery and or we can consider periodontal surgery with a laser today. Today we have a BioLace laser, which is at the forefront of periodontal therapy in reference to endpoint periodontal treatment in a non-invasive manner surgically. We can be actively involved in the treatment of those patients. Someone who has a gummy smile, where their gums are covering over their front teeth, which creates an aesthetic unpleasant nature, we can remove those gums and reposition those very nicely to help with the aesthetic value of a patient in the practice. The other restorative care that we can provide with Dr. Friedman is the salvageability or saving of teeth through crown lengthening. So there are a lot of procedures that are performed by a periodontist in conjunction with a restorative dentist that allow for a better outcome. Prognosis is good and aesthetics is excellent. And lastly, I would like to talk about a periodontist that's also a specialist in the surgical placement of dental implants. And dental implants are titanium metal pins that are placed into the jawbone and allowed to fuse to the jawbone so that they can act as new anchors. On top of those anchors, we can place teeth. And those teeth placements can be something that are fixed, that a patient cannot take in and out of their mouth, and or anchor a denture, something that can be removed in and out of the mouth, but can have a more solidified function with dental implants. So to recap, what I do in this practice is I help with advanced restorative treatment planning. I aid Dr. Friedman in his restorative care with the treatment of periodontal disease. And lastly, I place surgically his dental implants so that he can provide form, fit, and function, as well as advanced aesthetic results on dental implants.